We don't necessarily know if there are intrinsic or biological differences between these groups, by race or ethnicity. But what we do see is that these populations, for example, Black or Hispanic patients, they tend to do worse, whether it's looking at disease severity, progression. And while we think that there are genetic and environmental factors, a lot of these factors, such as social determinants of health, are likely to explain a lot of this. So, for example, we went over the recent changes in the prevalence estimates of MS across the United States would now show that, close to the white patient, Black patients are right at the same level of who gets MS, and also how many people are living with MS. So in practical senses, we're basically showing that there is, for every 1,000 white people, there is 4 white people living with MS. For every 1,000 Black people, there's 3 living with MS. So not a lot big difference. And then for Hispanic and multiracial, it's about 1 and 1.5 if you look within those groups. So this is telling us either we were getting it wrong in the past, where we used to say that MS didn't happen in these populations. So whether it's from structural racism or us not being able to count these patients because they were not coming to the right places or medical claims was not claiming them. I mean, those are issues that we looked into it. Or is it an issue that these populations are actually getting more MS because of environmental changes that have occurred in the last, 40 to 50 years? Or is it also that there are genetics, aspects that make them susceptible? I don't think it's just going to be genetics alone, but it's going to be an epigenetic phenomenon. And so I went over some of that data that supports pretty much everything. And so, for example, from the genetic standpoint, these are populations that are genetically admixed. And so we've looked at it through the Alliance for Research in Hispanic MS Consortium, where we've been able to show that, a lot of the heritability lies in that, European risk allele within these populations that can also be found in these populations. Other aspects we've shown also that, some of the common environmental exposures that have high risk of, leading to MS are also found in these populations. So, for example, EBV. And then the third, from the social determinants of health as well, we have an issue with diagnosis, right? So whether it's a diagnostic delay or an issue that, they are not diagnosed because of the color of their skin. So, perhaps that in the past led to less sort of estimation of who was having MS. So I went through all of that. And of course, in the end, in terms of progression or, worse outcomes, all of these likely play also a role. And but I think the highest variability is going to come from, and best explanation is going to be a lot of the social determinants of health, because these populations suffer from a lot of barriers to getting that diagnosis. And it's not just on the onus on them, but also on the physician bias.